Good morning, sir.
Good morning, Father.
Good morning, Father.
Sir, not audible, sir.
Hello.
Audible.
Hello.
Good morning, Father.
Good morning, sir.
Good morning, Father.
Good morning, Father.
Good morning, Father.
Yeah, good morning, good afternoon. I think I have some issue with that body.
Morning, Father.
Those who want to join and interact, various learners without background distractions can join here. Sending you the Zoom link.
Good morning, Father.
Only those who can on the video and interact and join here. As soon as possible. Mantu, are you there in the live? You can come here. I was asking for this room. Those who come to Zoom platform, get connected to YouTube Live as well.
Yeah.
Those who are here, please send some messages over there. Chat rate is 5. You have reached at least 30. To begin.
Hi, good morning, Father.
Sorry, my audio is not working. Let me check. Okay. Carry on. Send some messages at YouTube comment space. I want to see chat rate going to 30 at least. Send a couple of messages.
वीडियो ऑन करके रखना है नहीं तो अभी क्या कर
Good morning, Father. Thanks. Good morning, Father.
Good morning, sir.
Can you hear me?
Good morning,
Yes,
Father.
Morning, morning. Yes, smile.
Good morning, ma'am.
Good morning, Father.
Morning, good morning. I'm just adjusting my audio. Yes, today I'm on breath coverage with smile. Yesterday she wasn't with smile. I think she'll be present.
Yesterday I was in deep thinking.
Deep thinking. What was that? You can share with
It
us the
was
deep thinking.
related to part C.
Good morning, Father.
Part C. Okay, okay.
Yes,
What was the
Father.
deep thinking about part C?
Yes, but today I'm bit confident because I tried one part, so I got 6 numbers.
Okay.
Then I'm happy.
Okay.
I applied your strategies, Father, so that's why I'm happy.
Okay, great. And don't think of what you call immediate heal or cure or solution within just like giving an injection and bringing down the BP. You can't solve OET issues. It takes time.
Yes, Father.
Very hot here. Yes. Yeah, only 11. Chat rate is only 11. I'm waiting for 30 to start. Everybody has to type in what you learned from OET, the 7 mistakes or the 7 solutions, whatever you can type in. Yeah. Chat rate has gone to say 18. Let it be 30 at least. When it comes down, there's the minimum. When it comes down below, we will stop. Type in where are you from and our tagline, empower each other and grow together. Consistency. Fall in love with OET. Love Edu Skills OET. No smiles? Those at Zoom definitely should smile. Because I can't see YouTube live smiles. Okay. OET, yes. I am in Zoom, Ranjini, yes. Use quality time. Yeah, that's very, very important. Use quality time, the best time for OET. Even it's 10 minutes, the best time, not after your 15 hours duty. Okay. Only when it is the best time, you will have the stamina to smile at OET. Thank you, Madhusri, for the super chat. Yeah, Madhusri has purchased a super chat for 20 rupees. You can even start with the 10 rupees super chat. I wish everybody purchases one, 10 Indian rupees. Very simple. It costs 10 rupees. So whenever you attend, that helps us to reach to more deserving people. That's the main thing. Can I have everybody purchasing 10 rupees super chat? Some of you are not familiar. So once you try, then every time you will have a crown with your message. Shanmuga Priya, yes. 3, yes. Thank you, Shanmuga. Let me see crowns. It's not the money, but it helps us to reach more deserving people. Those who have purchased can explain to others. How do you do it in the phone? I don't know. So I'll arrange by the tech team. Can somebody explain what to do with it? The super chat, how to get it? Anyone? In the Zoom? Those who are in the YouTube can just type in there how to get it.
Hello.
Eliminate grammatically incorrect answer. Yes. Quality practice. Oh, Elizabeth. Yes. Thank you for the super chat. Yeah, Anu Sabin, thank you for the super chat. Yeah. Every time you post, you will have a crown with you. You purchase a super chat. You can purchase it for 10 rupees. Am I audible?
Yes, Father.
Yes, chat rate is only 19. I'm waiting for 30. Just type in. Type in, yes, Madhusri. Thank you. Yes, sir. Somebody please explain how to get super chat here at the Zoom. Nobody knows it? Hello,
Yes,
are you listening to me?
Yes, sir. Hello.
Please, somebody who has purchased, just explain what to be done in the phone. I don't know.
Hello.
Somebody, Shanmuga Priya says, when you touch the crown, it will lead you to buy the super chat. Anybody's crown you can touch? I don't know. Okay. So top fans now. So as per today, the top fans are Anu Sabin in the first place, Elizabeth in the second place, Madhusri in the third place, Shanmuga Priya 4, Ramanujan Damodaran 5th place, Mini Jackson 6th, Ganesh 7th, Josina Joy 8th, Rida Yusuf 9, Lua 10, Adira Ranjit 11, Dini Abraham 12, Samchana 13, Nimi John 14, Bharati 15. Yeah, this is a fan order. It all depends on your super chat as well as your messages. Yeah, your chat rate. Chat rate is just 15. I'm waiting for 30. Let's not waste our time. Chat fast. Send some messages from 23. Super chat is 23. Josna Jo, yes, thank you. Patience is the key to success. Yeah, somebody's Madhusri says in the next to chat space, there is an icon, dollar icon. Need to click on it, then the process continues. Everybody try to click on it. If you can just purchase for 10 rupees. Otherwise, at least you know the process. I'm giving you 2 minutes. Okay, otherwise, like we don't have sufficient people to go on with different batches now. That's why we are requesting you so that we reach out to many. Dorothy, super chat. Dorothy, yes. Anusabin, Dorothy, yes. I'm giving you 2 minutes to get a super chat. Everyone, please try. You can get it for rupees 10, Indian rupees 10. UK pound will be 0.10 or 0.01. Okay. Time is so greatest enemy. Yeah. Bharati, thank you. Thank you, Bharati, for the super chat. Yes. Santosh, yeah. Santosh, thank you so much for the super chat. Santosh, yes. Can I wait for some more? Fast. Today we'll be going with reading part C. If I missed any super chats, others can bring it to my notice, please. Yeah, Ramanujam says 100% free platform. Yes. Fall in love with OET. Annette, yes. Can I have one crown along with all your names? Fast. Good morning, Disha. Yes. Smile is our signatures in your crown. Yes. Consistency, patience. Should never forget those must be the first words. Smile, consistency, patience. Did you all try clicking on that button to get super chat? Those who
Father,
have tried, yeah, those who have tried, type in yes.
Father, I can't do. I don't know how to do actually super chat.
Let's just to click on that the button below. or click on any of the crown they say. I'm not sure how to do it in the form. Crown, you see a crown in front of some names?
Yeah,
Try
Father,
to click
just
on that. Click
on the
that
live
crown.
chat. Yeah. While click on the live chat, we can see a crown in the column. Just click over there. Then it's get an option like buy a crown super chat. Then we can just to add our UPA PIN number. Then it's straight away cut from our account.
Okay.
So it
We
starts
can
with
choose
10
the amount
rupees.
also there. And yeah,
Anything you can purchase starting from 10 rupees. Yes, Father. Yes, Saleen, yes. Shanmuga Priya, yes. Those who have tried, just type in yes. Quality of practice is more important than the quantity of practice. Good. EduSkills is a free platform. 23, still it is in 23. All have to chat together if it has to reach 30. Yes. I love OET. See, if you don't do what we request you without any problem, we will have to stop the sessions because we are struggling to carry on 3 batches. Altogether, you can see 30, 35 are there. If you divide them into 3 batches, only 10 will be there in one batch. And 5 will not be attending. Not only that, beginners, advanced, and all mixed up batches will not be that effective. So we want to carry separate batches. Otherwise, we'll be going only with the special batch for the next 3 months. So it's up to you to support the platform. See that you share to your contacts, invite people to join and all that. Otherwise, don't cry that, thank you, Nitya Binil, for the super chat. Yes. Then don't cry and request me because I can't carry on the classes. Now we were able to take any session, 2, 3 sessions for all the batches. But if I take separate 3 sessions, not even 10 members will be there to participate. Are you listening to me? So this is up to you, each one of you. If you think the other one will do it, nothing will happen. Because at least Indian 10 rupees super chat, if you can't afford, that shows you are taking things for granted. And all those who have purchased super chat, send me a message in WhatsApp, okay? Just now itself, you can send me one message. And the amount, if it is 10 rupees, 10 rupees, 20 rupees, 20 rupees, okay? Just send me a message in WhatsApp. Well, today or tomorrow, we will decide which class for whom it is to be carried out. People who are very negligent, we don't want to encourage. Thank you. Yes, shall we begin? Yeah, those who have purchased super chat. If not today, even earlier, if you have purchased, just send me a message, okay? All those who have purchased. So you need not waste time sending links and details to all other people. I can concentrate on people, those who take instructions. Okay, cool. Keep smiling.
Yeah.
Let's have a minute silent prayer. Good morning, good afternoon, good evening, wherever you are from different time zones. You are welcome to EduSkills OET Medicine. If you are watching this on YouTube, kindly consider subscribing channel, give us a thumbs up if you like our mission, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. So the new batches, the initiation is not okay because we were trying to get more people. As of now, we have maximum 35 for 3 batches. So we might cancel all the batches except special batches. We may go on with only special batches. We'll wait for 1 or 2 more days because this 1 month we will be having full sessions. And special batch sessions will be reserved only for them. It will be only in Zoom, not live streaming. And we'll be sending links only to those people. So it's up to you because you majority of the people here, those who are here, don't even want to send a message in the YouTube comment space. Chat rate is just 20. So that shows your negligence. You don't deserve free services. Yes. Even without a cost, you can send a message, but you don't want to do it. Yeah. Cool. And you can see how many likes are there. Not even half of the people have liked. Cool. We'll take strong decisions so that at least some people benefit. Your negligence will bring out or trouble other people who are the curious learners. Today we'll be dealing with OET Reading Part C, and we'll also be beginning with the discussion with some of the concerns that were being discussed yesterday in the group. And if you are ready, just type in ready. Yes, in the chat comment space. We are running on 13, chat rate 13. Very poor. Yes. I think we will disconnect YouTube Live because people don't want to interact or even send messages. Only those who are here in the Zoom classroom are sending messages. Yes. Those who are just watching only in YouTube, just type in Y, YouTube, YT, you can type in YT. I just want to see, otherwise I will disconnect it and go only on Zoom. Upcoming sessions we will have only on Zoom. Just type in Y or YT. YT means short form of YouTube, if you are watching only on YouTube. Otherwise, we are going to disconnect YouTube. Yes. One YT, only one YT, yes. I think only one or two are there. Dua, can you come in here? Maybe we will allow you to meet today. 1, 2, 3, 4, 5, 6. Yeah, Salafa, you don't want to come into Zoom classroom? If you want, you can join. I have posted the link in the chat comment space. Yes. Anyhow, today we will go. We'll decide tomorrow. Okay. Now, see, when we speak in such language, chat rate has gone to 36 within no time. It's no, I don't love to go into that language. I always love to smile and speak. Okay. Yeah, and it all depends. You'll have to send me a message if you are really serious learners. And from a special batch, you'll be removing all those. Already I have removed 16 plus 8, I think. 24. Others will be removed by today. I have sent the notice in the special batch, those who are not serious about learning. I am postponed. Okay, Salafa, I can understand. No problem. Okay, let me share my screen and let's just respond. Keep responding at YouTube comment space, okay? That helps us to reach more people. That's why we are requesting you. Even if you don't want to heed to that small request, why should I heed to all your messages and respond to it and take sessions? That's my question, yes. Yeah. You see my screen?
Yes.
Yeah, YouTube. Real serious learners will have special sessions these days until I complete my holidays. Okay. So OET 2.0 reading part C. We'll be going with one. Before that, some discussions were on yesterday in the platform groups. You know, this was one question being asked. The guideline highlights A, option A. So what are the hedging words in the question stem? If there are beginners, this is the question stem. Okay, the first line of the question. And when you say answer options, A, B, C, or D, they are the answer options. When we refer to as text or paragraph, That means all the whole text here. Okay. What to highlight?
Guideline.
Guideline. Highlights. Highlights is important. What is highlighted here? Okay. Option A, the need for accredited interpreters at all appointments if there is a language barrier. Come on, fast. Don't delay. If you delay, my energy will be dropped. I will be stopping very fast. Those who are here are supposed to interact at the Zoom classroom.
The need for accredited.
Louder, louder. I can't hear you.
All
See, at the Zoom, YouTube also, they can't hear you properly if you don't speak loud.
Accredited interpreter,
Accredited interpreters.
and if there is a language
If
barrier.
there is a language barrier.
Huh?
If there is a
There
language
is a language barrier.
If there is a language.
language barrier. Anything else?
all is there.
For
Absolutely all
all
is there.
is not absolute, Father.
It's not absolute.
Is it absolute or not absolute?
Not
No, not
absolute, Father.
absolute.
Okay, let's see. We'll come back. Option B, that an accredited interpreter is recommended for all antenatal visits.
All antenatal.
The all is an absolute, Father.
Absolute. Absolute.
Is it absolute?
Yeah,
Yes.
Father.
Okay. Let's see. Then accredited interpreter. Okay. Option C, that health professionals are responsible for translating discussions.
Health
Health professional
Respond-
translating.
translating discuss.
Okay, heading is involving an interpreter. Okay, pregnancy care guideline involving an interpreter. Interpreter is the main word here. Interpreter. Heading says interpreter is important. So is there interpreter in third option?
No.
No, Father.
No. Health professionals.
There is health professional. So concept is different. Gradually, you will come to know if the concept is different by itself, you can eliminate it. Because they're asking about a different, speaking about a different concept. But don't believe me, you can come back. Because some are saying that is that's the right answer. Anyhow, let's see. Okay, so there is a confusion. People say all is not absolute. Can somebody explain why do you say all is not absolute?
If there is
Because
language
this one you said absolute. If it is absolute, we can eliminate, right?
Yeah,
Yes.
Father.
Yes.
Then the other one is the answer. Don't believe me, okay? We'll find out from the text. This was being discussed yesterday. Many had sent me personal queries about it. Those who are involved in the discussion yesterday, if you are here, you can tell me what was your doubt so that others will understand. Come on, fast. Speak. This is all the opportunity you have. When I don't have interactions, I simply feel like stopping the session, okay? Yeah.
Father, I have the
Yeah.
doubt about this one. The option A is the correct answer according to the key. Then all the first paragraph, last line is says like that the same word, or the paraphrasing of the option A. But I have doubt about the.
This one you mean recommended for all internet lesson is the health professional and women contain community.
it is saying if there is if the health
If there
professional
is
and the woman
language
has
barrier.
difficult
And the
communicating.
women have.
Not the same, no?
One sec, okay, one sec. Hold on, I am busy. Just discuss yourself. One sec, somebody is calling.
Excuse me, sisters.
Yeah.
Actually, I couldn't do that grounding. I'm trying, but not cannot do. You please help me, okay, after the class.
Okay.
Yeah. Oh, otherwise you can help me now because father is not here. I went to touch the crown, okay. Then after that, it is coming. Edu Skills, something, yeah. Wait, okay.
Then you can see a buy a super chat. Just click the sentence, buy a super chat.
EduSkills OET. The rate is 40 rupees. So
Yeah, it's 40 or
yeah, below that stay back there, then tap to buy to complete your purchase. Okay, then I click there. I have to click there and buy, right?
Yes.
yeah.
So I click okay.
Did you come to a conclusion? Hello.
Yes, Father.
For this, did you discuss? If you have not discussed, I will just go through the YouTube live later. If you are just sitting, I will simply cancel these Zoom sessions. Because when I am in an emergency, if you can't manage 5 minutes, you are not active learners. What was the discussion? Just let's repeat it. Let's see who all discussed it.
And to get the super chat, so Jenny helping her to buy the one.
Louder, louder.
Prabha
Prabha
buy the super chat, so helping her
Helping her.
goes through the
It's done.
the steps.
Yeah, it's done. It's done.
Option B is not saying communication barrier, so you can eliminate, and the meaning is absolute because option says all antenatal disease. Okay, option B. Somebody is commenting option B is not saying communication barrier. That an accurate interpreter is recommended for all antenatal disease. Okay.
But in the text saying further, all antenatal is if the health professional and women have difficult communicating. If there is also, but that's why we can eliminate.
Eliminate which one?
B.
Okay. Yeah, B says interpreter communication is there. Accredited interpreter means that itself says the need for communication, difficulty in communication. So an interpreter is required. You understand this accredited interpreter means, for example, you know only Malayalam. There is a Bengali who is coming to your clinic, and how do you understand what problem he has?
Yes,
so you need somebody who knows both Bengali and Malayali to interpret or translate what the patient is saying.
Yes, Father.
Okay.
We have in the hospital like that also. All interpreter is there.
Yeah.
Who don't know the language, that the accredited interpreter, they will come and explain.
Yeah. If there is no OET exam, there would have been much more interpreters in European countries because you will not understand what they are speaking. So everywhere, if there are Malayali nurses, there should have been a person who knows English and Malayalam to interpret, translate, and tell you. That's why OET is there, so that you are competent in English. Yes. Okay. Recommended for all antenatal appointments if the health professional and the women have difficulty communicating, if there is a language barrier. If this is synonym of if there is a language barrier in the first option. The need for accredited interpreters at all appointments. If means only some appointments, not all the appointments. Meaning is not absolute. Though absolute word is used, meaning is not absolute.
Absolute.
Yeah, means the need for accredited interpreters at all appointments if there is a language barrier. For example, there are 100 appointments today and 20 people have language barrier. So how many interpreters are required? For how many cases interpreters are required? 20 cases. Out of 100, 20 cases. 20 cases is not all, no, 100%.
Yes.
So this means some may require accredited interpreters if there is language barrier. That's only a competency issue. Gradually you will develop. Okay. For example, all nurses should attend the meeting if you are free. If you are free on that day, which means those who are free need not attend, right? Does it mean all must attend? No, those who can
No,
must
those who
attend.
are free.
Yeah. Yeah, just read this past paragraph.
Is Pregnancy Care Guidelines 2018 involving an interpreter. It is the responsibility of the health professional to make sure that communication is clear. Accredited healthcare interpreters assist by translating the discussion between the health professional and the woman, communicating with the woman in her preferred language, either in a person or through a telephone service, involving an accredited interpreter, preferably with the training in medical terminology, recommended for all antenatal appointment if the health professionals and the woman have difficulty communicating.
Okay. Now, what is the topic sentence? This is the topic sentence. And what is the controlling idea?
Communication.
Communication is clear.
Communication is clear.
Communication.
Clear communication is the
Clear.
controlling idea.
Controlling idea.
Clear communication. So that is the idea being explained in the whole full paragraph, nothing else. So if there is nothing to do with communication, that will not belong to that paragraph. Okay. The need for accredited interpreters at all appointments if there is a language barrier. Third one is the health professionals are responsible for translating discussions. Is it given anywhere in this paragraph?
No, Father.
No, the
No.
interpreters will do the translation,
Yeah,
not the health
that's
professional.
understood. If the health professionals can translate, why should they have interpreters, right? Which means no interpreter is required. So third one is option is eliminated. And here interpreters accredited by NAATI, all this is telling what should be the qualification of interpreters. Do we need to read those things?
No, Father.
No. That's how you defeat time. So understand this very well, okay? Answer meaning should be absolute. Having absolute words is not enough, but meaning should be. Here you see, recommended for all antenatal visits. That is opposite to first. First one says not all, but only when there is a language barrier. Here they say all. So that is absolute. If you have gone through yesterday's video, you know this, right? Okay, 7 principles. I taught in very beginning yesterday's video, it was mentioning. Okay, one is
Always.
Eliminate the
eliminate the
Eliminate
absolute,
the absolute.
eliminate the wrong ones. Look for precise
Look for
language.
precise
Yesterday I said
language.
grammatical mistakes. If there is a grammatical mistake in any of the answer options, that will never be the right answer. Straight opposites, one of them is correct. Automatically the other two are eliminated. We had
Eliminated.
yesterday, right? Yesterday we had
Yes.
conclusive and inconclusive. So this is the principle. And we had precise language principle as well as absolute. Radical answers incorrect, goes beyond the boundaries. That's exactly almost like absolutes. Educated guess, logic, elimination, compare with questions. Now don't worry, we'll random guess, prefixed answer. Prefixed answer means on the day of the examination, 8 minutes after your breakfast, you can fix one answer. A, B, or C, or D. For example, I am not able to answer. If I am not able to answer 4 questions, what answer will I write? You can fix and go and write that. And you will have more chances to have the right answers than writing A for one, B for another, C for elimination. Let's see this one. It looks almost similar. Am I sharing the screen?
No screen, sir.
No screen.
Yes,
No?
Father.
Yes, Father.
Now, okay, Father.
Okay, but at YouTube it has not reached, right? Okay, it takes a couple of seconds. delay. Yes. Yes. Now done, right? The policy recommends that vitamin K be policy.
The policy and vitamin K.
Recommends
Vitamin K.
vitamin K.
Policy is important provided you know what is a guideline, what is a notice, what is a email, what is a policy. Then only that is required. As of now, I don't think you know recommends is important. Why?
How much?
Why?
Kachi.
Okay, let's see. A, by a trained health professional.
Trend.
Trained health professional.
I think in the question there is a mistake, right? Question spelling. Vitamin K be administered by, right? Must be, I don't know. Where did I get this material? Let me, for the sake of understanding, administered by trained health professional. Then
Within the first month of
The
birth.
first month
First
of
month of
First
Yeah.
month after birth.
First one says who has to do it. Second one says when it is to be done. Only if they are healthy.
Healthy.
if they are healthy.
If they are healthy.
Only.
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 What is it?
Not absolute.
Is it absolute?
No, father.
No,
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 absolute.
father.
Only if they are healthy. Those who are healthy is not all. No? All are not healthy. Okay. Only those who are healthy. Maybe out of 50 people, 10 people are healthy. Yes. So this is not absolute. And what is the criteria I told you? If that is not the absolute?
That is the answer.
The meaning is not absolute.
If an absolute word is used and if that is not absolute,
Probably that will be the
if the
answer.
meaning is not
That
absolute,
Meaning is not
90%
absolute.
chance is there, that must be the answer. That's the
answer.
normal trick they play. 90 plus chances tells you that must be the answer. And if I am answering OET, immediately I will write that answer. I will not do anything else. Okay. Let's see. Let's check. Can somebody read this?
Vitamin K administration to the newborn infants. Healthy newborn infants should receive vitamin either by intramuscular injection of 1 mg of chloroquine at birth. This is the preferred
Bracket you
dose
can
of,
avoid. Bracket you can avoid.
or as a 2 mg oral dose of the chloroquine given at birth at the time of the newborn screening and in the 4th week. The last dose is not required in the infants, predominantly formula feed. It is imperative the third dose is given no later than 4 weeks after birth, as effect as of earlier doses decrease after this time.
Did it?
I cannot see further that down.
Can see? Those who can see, please continue reading fast.
Undertaking this form of prophylaxis requires that the parent accept responsibility and that clinicians support and advise them in the administration of the third dose. If the infant vomits or regurgitates the formulation within 1 hour of administration, the oral dose should be repeated.
Okay. So why this is the answer?
The topic sentence itself saying healthy newborn infants receive vitamin either by intramuscular injection.
Yeah. Anything with this word?
Recommend. Should.
Yeah. When there is recommend, receive vitamin. Okay. How beautiful it is here. First topic sentence itself is giving. Yesterday we have seen so many answers were in the topic sentence. That's why we are stressing on paragraph structure. Okay. healthy newborn infant should receive vitamin only if they are healthy. Policy recommends that vitamin K be administered only if they are healthy. The topic sentence itself, the administration of vitamin B is only for healthy infants. Okay, and recommends should, and it is imperative. What is the modal verb synonym of imperative?
Necessary.
Necessary means must.
Imperative is important.
Requires
Requires,
requires
yeah.
means must.
Must.
So all this must is not relevant at all because they are speaking about a recommendation.
Recommends. Yes.
So only should must be the answer. So as soon as you see recommends here, if you find should here, that is the answer.
Nice.
That's a modal verb elimination. Without this, you can go here with this modal verb without even only and absolute and other principles. If you read the topic sentence, you find should is there, so recommendation, that is the recommendation. Okay, there is one should here, but that is not concerned with this topic. You know, it says if the infant vomits or regurgitates the formulation within 1 hour of administration, the oral dose should be repeated. Okay, that is nothing to do with vitamin A administration. Is that clear?
Yes.
Yes.
Yeah. So you see, recommends given to infants. So that is not administration given to infants. Okay. It was missing there. That is it. Yeah, given to infants. Something was missing here. Yeah, given to infants. Yeah. Now you see, by a trained health professional, by whom it should be given. Do they recommend who should give it? No. Within the first month of birth, when it is to be given, it says, here I highlighted somewhere here. See, given at birth, 4th week, all those things are there to confuse you. When it is to be given, only if they are healthy. Not all infants, some infants, healthy infants must be given. So only is not 0. It is some, meaning it's some. Okay. This is what I said, modal verbs can be used for elimination. Should, recommend, should, not required. Imperative, requires. All this is synonymous of must. Yeah. So if you remember, modal verbs can, could, ability, possibility, permission, may, might, possibility, should, advise, recommendation, suggestion, must, necessity, obligation. This you should be very familiar. This table. Okay. For example, can, ability, possibility, permission. Of course, I can swim. I can swim, showing my ability. I can jump. May I start now? Yes, you may. I permit you permission. Or possibility. I may have night duty today. It's a possibility. I may have. Because the nursing superintendent told me, if required, you'll be called for night duty today. So you are not sure. May. Advice, recommendation, suggestion. You look unwell. You should see a doctor. You should drink 3 liters of water every day. Okay, you should sleep at least 6 hours. It's not mandatory. No penalization if you don't do it. So it's all advice. Drivers must obey the road rules. If you don't obey the road rules, you will get the tickets. Penalty will be there. So must is necessary, obligatory, or mandatory. Okay. Okay, let's see. Now, can you tell us what are the functions of these things? Trees are lovely. What is it?
Opinion.
Is it a factual statement or opinion or advice or speculation?
Opinion.
Okay, trees are lovely. Is your opinion. Somebody else will say, no? Somebody else will say horrible. Some jana may say horrible. Trees are never lovely. You say curse to human race because there is a tree in front of our house which causes her to clean her surroundings every day. Okay? So its opinion differs from person to person. They make oxygen.
Factual statement.
Yeah, it's a factual
Factual
statement. Whether
statement.
it's not an
Right.
opinion. Wherever trees are there, they produce oxygen or make oxygen. We should all plant one.
Recommendation.
Recommendation.
Recommendation or suggestion or advice, whatever.
Suggestion.
All these are same. Okay. Recommendation. It could change cities by providing more shade.
Speculation.
Speculation.
Speculation or prediction. Okay,
Prediction.
about the future. So you should, if you are able to understand what is the function of each sentence or each portion of the sentence in a paragraph, that is the best competency. Is it an opinion? And in the part C, you have a lot of things based on opinion. You will see the headings, question term saying suggest. Okay, so and so the writer suggests or says, all these are opinions. So you should be able to differentiate between fact and opinion. Okay.
Father, excuse me.
Yes. Yeah. Please.
Can and may is possibility, no?
Can. May.
Yeah. Yeah, both
May
are
is, no. Can is ability, not possibility. I can swim. It's not possibility, no. I know I can swim.
Oh, okay.
I can sing. It's not possibility. I can sing. That is my ability. What do you say in Malayalam? Kazhivu. Kazhivu is not sadhyata. Right? I can swim means I can sing means I can sing. It's not possibility. Maybe if you had an accident, then you had some problem with your vocal cord, then you say, I may be able to sing again in the future. Possibility. But if you say
But
I can
it is
sing,
in
there is no problem.
the
Yeah.
it is written in the function possibility and may also possibility written. That's why I have a doubt.
Not possibility.
In modal verbs, no? Can, may, should, must. It is written can, ability, possibility, permission. May, possibility. That's why I have a doubt.
So may is permission. Right? I'm sorry. Check if I can read that. Okay, go back. Can is ability. Just understand that. Can is ability. May is might.
Possibility.
You may have.
Possibility.
You might have. Possibility. And should is advice, recommendation, suggestion. Must is necessity, obligation, mandatory, all of those things. That's this vision. Okay. Is that clear?
Okay, Father. Thank you. Clear.
Okay. I'm not going to go back. It's delaying. Yeah. Why language matters in OET part C? OET test professional judgment, not memorization. So that's why I asked you to go for a picnic on the previous day. Nothing to memorize by heart. Okay? It looks at your professional judgment. If your mind is cool and free without fear and stress, you'll be able to do professional judgment. Correct answers always reflect clinical realism. Clinical realism.
Yes.
Clinical realism is no extremes. No doctor will say the bypass surgery will be successful. Will they say? No. It all relative, depends. Extreme and rigid statements are rare in healthcare texts. You can say paracetamol can be given to all the patients. Some will be allergic to paracetamol, right?
Yes.
So understanding language tone helps you eliminate distractors quickly. You should be able to understand the tone as well. Tone means the mood. Absolute common words used here is always, never, only, completely, entirely, all, none. Normally used. These are the absolute words normally used. So consent is always required in every situation. Is it right?
Yes.
Consent is always required in every situation. Is the statement right?
No, Father.
No. In some situations, you cannot get consent. You will have to save the life, right?
Yes, Father. For
Yes,
emergency
sir.
situation,
There's an emergency accident case who has come to the hospital. Somebody has brought it. Who will give the consent now?
sometimes
You
doctors
keep-
also will
keep-
take.
You
Yeah,
will keep the patient outside in the bus stand until somebody comes to consent.
no,
No.
Father.
Yeah, so consent is not always required, generally required. Telehealth completely replaces face-to consultations. Wrong, absolute expression. Older adults never adhere to medication plans. Old people never adhere to medication plans. Do you agree?
No.
No, it's extreme. Complaints are only caused by medical errors.
No.
Even if there is no medical error, you can see some patients keep on complaining, right? They keep, yeah. Absolute language always, never, only, completely, all patients in these examples. Okay, let's see. Now, I want one to come forward and explain this. Let's see how much you understand. Sharing is in trouble. Let me take the chance. Others will assist you. Okay? Then we'll go to the next scene. Can somebody? I will just take the question stem and options. I will explain. Rest you will have to explain. Okay? Somebody will read and explain. Let's see. You have to speak loud. Okay? Make mistakes, no problem. What is identified as the most common cause of patient complaints?
Most common.
Most common
Most
cause.
common.
Common cause of patient complaints.
Patient complaints must be the main idea, right? Managing patient complaints in healthcare. Patient complaints is the main idea. Okay. Option A, serious clinical errors.
Clinical errors.
Clinical errors.
Okay. B, communication problems and unmet expectations.
Conjunction.
And
Problems and
Fanboy.
expectations.
fanboys.
Fanboy.
And
Fanboy is there, what happens? Fangirl will be
Communication
happy.
problems and
If there is
Maybe
fanboy,
the
fangirl will
answer.
be happy, right?
There is chances.
yes.
90%
So
correct.
girls are all become fans of fanboys. Okay. So what does it say? What does it say?
It is
It must
90%.
Most probably that is the answer.
Yeah,
Probably.
most probably that is the answer. Most probably that is the
That's the
answer.
answer.
In OET teaching, always believe me, I never use absolutes. I don't say always it must be the answer. 90 plus, 95 plus, 99 plus. Most of the time. But my experience is that is the answer. But I will never teach in that language because you should never believe me when I say these things. You should convince yourself only by practice. Okay. Only failures in medical treatment.
Only.
Only it's an absolute.
Only
Father.
absolute.
So what happens?
Eliminate.
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 One is gone. Always staff negligence.
That also
Always.
Always
absolute.
an absolute.
we can
Always
eliminate.
absolute.
Even from your general knowledge, always cannot be staff negligence. There are other reasons for this one, right? Patient
Patient
complaint.
complaint.
So
Yes,
that also
yes.
can be eliminated.
Eliminate.
That's great. Now you have these two. But since you are all fans of fanboys, B is the right answer. But somebody has to explain to me. Reading the text. Come on.
Yes, Father. That
Yeah, please. Read the text, then explain.
managing patient
complaints in healthcare.
One. Other one I will give you next chance. Don't worry. Loud, speak loud, okay? Hold the microphone closer. Yeah.
Managing patient complaints in healthcare. Patient complaints are an important source of feedback for healthcare organizations and can contribute to service improvement when handled appropriately. Most complaints arise from communications breakdowns, unmet expectations. This is me. Most complaints arise from communication breakdowns, unmet expectations, or delays in care rather than clinical incompetence. So this is the
Louder,
answer.
please. Hold the microphone closer and speak louder.
Effective complaints. Most
Please continue.
complaints arise from effective complaints management requires timely acknowledgement, a clear explanation, and where appropriate, an apology. Staff involved should be supported throughout the process to encourage openness and learning. While not all complaints can be resolved to the patient's full satisfaction, a transparent and respectful response can reduce dissatisfaction and prevent escalation. Importantly, organizations should analyze complaint trends to identify systemic issues rather than viewing complaints as isolated events or assigning individuals blame prematurely.
Okay. Could you
So there
explain?
is the supporting sentence is saying most complaints arise from communication breakdowns, unmet expectations. This is the answer. Or delays in care.
That's great. That's wonderful. So here also you have this one, complaints arise from communication breakdowns. And you have one more for delays in care rather than clinical incompetence. But one more is there, but they have only the two. Most complaints. What is most?
Scale.
Communication
Scale.
problem.
When there is a scale expression, there is a signal, there is an answer, right? So
Yes.
even otherwise, I said when fanboys is there, it is automatically eliminated. Once you are competent, you will not read anything. C and D were definitely eliminated because of absolutes. B is selected because there is a fanboy. Serious clinical errors. From your general knowledge, you can understand, is it only because of the serious clinical errors patients complain?
No, Father.
Patients will complain saying that there is some worm in the bread, or there is some wind is coming from this window, and all anything and everything, right?
Simple pain also they will complain.
Pardon?
Simple pain also they will complain.
Yeah. So many complaints. So from your general knowledge, you know, serious clinical errors cannot be the most common cause. Medical failures in medical treatment cannot be the most common cause. Always staff negligence cannot be the most. Most is important. Okay, scale, right?
Yes.
Why? Because here they are saying most. And most common cause, not the only reason for cause, most common cause is communication problems and unmet expectations. I thought when I came here, there will be one nurse attending me 24 hours. That was the expectation of the patient. But when the patient came, the nurse is attending to the next, almost most of the time she is attending to another patient. This patient feels so jealous, starts complaining. See, even from your common sense, you can understand these things very easily. It cannot be serious. Most common cause is serious clinical errors. Serious clinical errors are exceptions, right? They never happen always. And failures in medical treatment, they don't happen always. Always staff negligence? No. So that is cool. Thank you. Thank you for explaining. Next one also someone else will explain. Okay. So do you need to read all these things when you have this here? Answer here.
No,
First of all,
Father.
if you are competent, you can see the fanboys, other two are eliminated, then you can select that. When you come back, you complete the whole C part. Then when you come back, you can go back and again confirm or reconfirm if you want. Otherwise, don't believe me now. Once you are competent, you will select this within seconds. You will answer this question within 30 seconds. Okay. Even otherwise, if you read, this portion need not be read because the second line itself, supporting sentence, gives the answer. Okay. So the answer is here. Now this one, let's see. According to the text, which statement best reflects the use of telehealth in primary care? First.
Best reflects.
Best reflects.
Best reflects.
Okay.
Telehealth in
Best
primary
In
care.
primary care.
Right. Option here, telehealth. That's there in all the four. So you need not highlight. Telehealth is always appropriate for managing chronic conditions.
Always.
Always. Absolute time.
Chronic condition.
Always.
So what happens?
Can eliminate.
Yeah. Don't believe these people if there are beginners. Don't believe them at all, okay? They will say all this, but you should convince yourself, then only you should believe. So option B, telehealth can be useful, but is not suitable for all situations.
All situations.
No further. This is not.
No, no.
Further,
It is not suitable
It's
for
not
all
Fanboy,
situations.
Not absolute.
but is
Not
here
absolute.
for them.
But is not
But is
suitable. So
Not suitable for all situation means.
some
there are
Suitable for
some
some
situations.
situations.
for some
And
situations.
as per our principle, what is this option?
This
Most
If
probably
absolute,
the
if,
answer.
Will be
if
the right
absolute
Must
is
be the
used and
answer.
if that
There
if
is
the
chances.
absolute word, if the absolute word is used, if that is not absolute in meaning, 99+%, that is the right
99%.
answer.
It will be
Might
the
be
right
the
answer.
answer.
Yeah. And if I am answering, I will just select the answer and go within 10 seconds, 5 seconds. Okay. Then after the exam, if they allow, I will go for a performance. Yes. Okay. See, telehealth completely replaces the need for physical examination. Only over the phone.
Completely.
Completely is
Completely replaces. That's why it's absolute
Absolute.
further.
And you know that
Eliminate.
you can never believe whatever the information technology advancements, can all the questions be treated by telehealth or telephone calls without a physical examination? Not possible, right? So you can eliminate that.
Only.
Telehealth should only be used when patients request it. You
Only.
should,
Only.
which means you should never call a patient. Only if they request, you should. Health professional should never contact a person over telephone. Sorry, that is not green, right? Red, right?
It's eliminated.
Hmm?
Eliminated.
Yeah, I eliminate. Don't believe them, okay? You are beginners. Yeah. Then why should you read the paragraph?
No need to read the paragraph.
Still, let's
Only
see.
for satisfaction.
Yeah, satisfaction. Somebody will explain. Read and explain. Yes, yeah. Just to find where, confirm that is the answer.
Telehealth consultation in primary care. Telehealth consultation have become an important component of primary care, particularly for patients with stable chronic conditions. They allow clinicians to monitor symptoms, review test results, and provide follow-up advice without requiring in-person visits. However, telehealth is not suitable for all clinical situations. Patients presenting with new, complex, or worsening symptoms may require physical examination to ensure accurate diagnosis. Additionally, technological barriers such as limited internet access or lack of digital literacy can affect the quality of virtual consultations. Therefore, clinicians must use professional judgment to determine when telehealth is appropriate and when face-to-face assessment is necessary to maintain patient safety and quality of care.
Want to explain?
In the topic,
However,
However,
telehealth is
contrast.
not
However,
suitable
is
for
there
all
for
clinical situations.
That's where
Answer is there.
I know, however, is there. What is the I know, however, is there. Everybody
after
sees it.
contrast word, it will be
That
our answer. It will
Okay.
be
answer.
always
If there is a contrast word, after the contrast word,
after the
Word,
contrast word is
answer.
the answer.
more than that, you see, if you understand the controlling idea of the topic sentence, first sentence is the topic sentence, which says telehealth communications have become an important component of primary care. heart, the existence of a healthy heart is an important component of healthy life. Does it mean heart is the only thing required for a healthy life?
No, Father.
No,
No.
Father.
Means important component. It is one of the important components of primary care. Means that is not all. That is not complete. That's not the only important thing. There are so many other things. So controlling idea gives a message. This is only one part, one component. Becomes an important component. Component means part.
There is one part. Maybe fourth part. That is this part is very important, like that.
Yeah. So, but then that is not the only thing. So always, completely, only, all those cannot be. So answer is there soon after the contrast word.
Contrast.
Yeah, so beautiful. You want to do one more?
Yes, Father.
Yes,
Yeah. So you did not read what comes after this answer, right? You can save time.
Yes.
Okay, so the answer is second one. Yeah, one more. What does the text suggest about medication adherence in older adults?
Suggest.
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 medication adherence.
Medication adherence in older adults.
Older adults.
That is topic sentence.
So what?
Okay.
Always
Option
is an
A,
absolute.
older adults always struggle to follow medication instructions.
Always struggle.
Always is an
is
absolute.
absolute, Father.
Sorry.
So what happens?
We can eliminate.
Eliminate.
Please go on. Medication adherence depends on individual circumstances.
Depends on individual.
Depends on individual circumstances.
Family involvement completely solves adherence problems.
Completely is an
Completely
absolute.
is absolute.
We can eliminate,
Absolute.
Father. This is absolute.
Go on. Go on. Healthcare professionals should never question adherence in older patients. Never question.
Never.
Never question. Never.
Never question. You can never question. Who can say that? Extreme, right?
Yes.
So
So the answer is B.
So why should you go to the
Medication
text?
adherence.
Why should you go to the text? This is not selected.
Not
Okay, this
such
is in the flow. 1, 2, 3. This is in the flow, not selected at all. From the same material. I don't know. Somebody has sent the material here. So somebody can read and confirm whether that is the one. Medication adherence depends on individual circumstances. Just read and explain. Loud, do it loud, okay, with some energy. Otherwise, people will go to sleep. Yeah. Chat rate has come down to 4. Almost time to stop. Yeah. Louder. Hold the mic closer, okay? Yeah. Please, continue.
Medication adherence in older adults. Medication adherence among older adults is influenced by several factors, including cognitive functions, complexity of treatment regimens, and social support. Some patients may forget doses, misunderstand instructions, or experience side effects that discourage regular use. Clear communication, simplified dosing schedules, or regular follow-up can significantly improve adherence. Involving family members or caregivers may also support patients in managing long-term therapies. However, it cannot be assumed that all older adults struggle with adherence, as many manage their medications effectively. Healthcare professionals should therefore assess adherence on an individual basis rather than relying on age-related assumptions.
Last line.
Should suggest.
Explain.
Rather than relying on age-related assumptions.
Yeah, one was read it, can explain fast. Others can assist. Hello, don't delay. That
The question
take Takes away the energy, okay? Don't delay.
It is this, but the topic sentence is saying influenced by several factors. It is
Several
explaining
factors.
the several factors. After contrast word, however, is there. After only that answer it will be there. Then ultimately that healthcare should is the suggest that model verb further. Should suggest, therefore, adherence on individual basis. Individual basis means individual circumstance, depends on the, then relying on age-related assumptions.
So
It is a
suggestion is-
age-related assumptions, not only for older adults.
Yeah. Yeah, medication adherence and all. Yeah. Healthcare professionals should therefore assess adherence on an individual basis, individual circumstances. Inference-based question. Inference-based question answering the conclusion. Okay. When you read, you will understand they are saying so many several factors. Means individual circumstances. Different circumstances. So first one is cognitive function.
Complexity of the treatment.
Then you have complexity of treatment regimens.
Social support.
Then you have social support. Then you have forgetfulness of some patients. Misunderstanding interactions. These are all several factors, right?
Side effects.
Oh, sorry, that is fine. Okay. Then experience side effects that discourage regular use, clear communication, all these can improve adherence. Involving family members or caregivers may also support patients in managing long-term therapies. However, cannot be assumed that all adults struggle with adherence, as many manage their medications effectively. That is opposite of older adults always struggle to follow medication.
Opposite of A.
Yeah, that's the opposite of this one. No, this one, which one? It cannot be assumed. Sorry. Cannot be assumed that all of this struggle their medications effectively. Option A is the opposite of this, right? That's also older people always struggle. This is it cannot be assumed that all older people struggle with adherence. So, see, several factors. Medication adherence among older adults is influenced by several factors. Immediately, your question is, which are those several factors? Number one factor, cognitive function. Number two, complexity of treatment. Number three, social support. Number four, forget doses. Number five, misunderstand instructions. Number six, experience side effects. That first portion says what are the several factors. Next portion says what are the solutions.
Yes.
What are the solutions? What are the solutions? Clear communication.
Clear communication
Involving family members.
Regular follow-up.
Involving family members.
Yes.
Regular follow-up.
Regular follow-up.
Then involving family members.
Involving family members or caregivers.
Family members.
Or caregivers.
Caregivers, yeah. Yeah, so 1, 2, 3, 4. 1, 2, 3, 4, 5, 6.
6, 7.
6 factors are there. 4 solutions are there. Then conclusion. All are not struggling. Healthcare professionals should therefore assess adherence on an individual basis. Which factor? Out of 6 factors, 1 factor or 2 factors will be affecting this patient. So another factor will be affecting the other patient. So simple, right? How beautiful the paragraph structure you see. You know, if you remember that DVT paragraph, what was that? The topic sentence was something like that. Long haul flights.
Long haul flights, yes, further.
Several factors.
Yeah, several factors, something like that. No? Yeah, exactly. Same, similar. Any paragraph you take, it is similar. Because these are all taken from medical journals, which means they are authentic scientific paragraphs. And you will see the beauty when you write your letters, the body paragraphs, how sweet you can write with this idea. Even when you speak, communicate in the speaking subtest, I'll tell you how you can simply construct a paragraph, small paragraph to tell the patient this. Okay? How beautiful. You have time now to go on.
Excuse me, Father.
Yes,
Yeah,
Father.
please.
Can you show me the screen, the previous?
You mean this one?
Father, this supporting sentence will be from some patients may forget doses.
Yeah.
It's supported sentence.
Yeah.
Okay.
This is topic sentence. Influenced by several factors. Actually, here it is clubbed together. You can take this way. This is the topic sentence. Okay. This can be considered as a supporting sentence.
Yes,
because
that's why I'm
including is there. And this is second supporting sentence.
Okay, fine.
Okay. Then the other one also is supporting. Now supporting sentences. You don't have developing sentences here. No example, no illustration given.
Okay.
Is that cool?
Yes, Father. Thank you so much.
Sometimes the first part of another situation is there. Sometimes this first phrase will be connecting to the previous paragraph. So that will not be important as a topic sentence. Second portion will be important. Sometimes the whole sentence. Most of the time, the whole 10 sentence is the topic sentence.
Okay.
In some situations, when including or something of that sort is given, that says several factors includes these factors, right? That's the answer to which are the factors. Got it?
Yes, Father.
Yeah, that's a very relevant question. Yes. Yeah.
Thank you, Father.
Yeah. Eliminate the extremes. You know, if there are beginners, I am just showing what is extreme. Always, often, most of the time, sometimes, seldom, rarely, never. Yesterday, seldom was there, right? Yesterday, in one option, there was seldom.
Yes, Father.
Seldom.
Yes, Father.
Yeah, seldom means after that, rarely is there, never is there. Never is 0. If you simply say, just not exactly, never 0, rarely 10, seldom 20%. Okay? Sometimes 40%, most of the time 80%, often 90%, always 100%. So which are the absolute words? Always and never. Means the
Never.
extreme North Pole and South
Yes.
Pole. Extreme North Pole and South Pole. Okay, all here, all, most, many, a few or some few. Few is 0. There are few students in the classroom means there are no students in the classroom. When you add article A, it becomes some. There is little water in the well means there is no water in the well. There is a little water means there is some water. So extremes are all and few. If these expressions are there, immediately you can eliminate. So as I have seen, always, never, only, completely, entirely, all, none. So which are the common words are these? North, south options, extreme values. Avoid north, south options, extreme values. Never, all, every, always, none. All these words are extreme words. Normally, these words in an option tells you that's a wrong answer. But sometimes these words will appear in an answer option, but the meaning will not be absolute. Then that is the right answer. Now the examiners are very tricky. Now Saleen is teaching absolutes you can eliminate. Next session I am teaching absolute, meaning is not absolute. If you don't attend that session, you will eliminate absolute, right? So they're very tricky. These are the tricks they play. As soon as you see the questions, you will understand. Options you will understand. Come on, this is the trick. All is used, but the meaning is not all. Come on, I know the trick. Immediately you select that answer. Not now, don't believe me. Only when you are convinced.
Excuse me, sir.
Okay. Yes, please.
Yes, sir. You said like absolute, we will be like absolute words will be eliminating. If meaning is not absolute, is that answer is right?
Yeah, 99%.
90%.
99%.
90% the possibility.
Yeah.
So if the absolute with the presence of absolute word, meaning is not absolute, the 99% the answer
Yeah.
will be right.
Yeah. And if at all you don't have time, that will never happen if you really follow my instructions. So that will never ever happen. If at all you don't have time, you have 3 questions and you find such answer, you can immediately take and go because 99% or 90+% possibility is there, right? See the options
Yes.
because you have no time to read the passage, Only 5 minutes are left and you have 4 or 5 questions left out. So just read. If any of these principles apply, select that answer and go to the next.
Thank you, sir.
99.9% you'll be right. But don't believe me. Get convinced by your practice. Okay?
Yes. Yeah.
Yes. Yeah. So principles of elimination, absolutes, quite opposites. Can be eliminated. Even modal verbs can be used. And if you want clarity, this doesn't mean exactly 90 or 51 or 50 or all those things. Okay? Just to give you an idea, all is 100, that is extreme pole, absolute. Most 90 plus, majority 51 plus, minority below 50, if you sum 1 plus anything, you make 0. That is also the scale expression. Okay, exception to the principle of absolute. Meaning of the sentence option is, answer option is not absolute, is an exception. Meaning is not absolute, but there is an absolute word. That cannot be eliminated, and 99% that can be selected as the correct answer. And opinions. Again, I am telling you opinions, it doesn't mean absolutes cannot be eliminated. Some situations is an exception in opinion. When somebody is saying their opinion, absolute can be used. Okay? Maybe Madhusri is having a proposal. Sorry if you are married, don't have the second proposal. Just an example. And Madhusri may say he is the best guy in the world. Okay? But then Jaya will say no. But then Madhusri has the right to say the best, right? That's an opinion, not factual statement. So in such situations, some situations, not always, absolutes can be right answers. I'll give you one example. Okay, don't worry. Exception, the meaning of the sentence is not absolute. Exception, opinion. Let's take one opinion. Yeah, this will be an opinion. Just to give you an answer, example about opinion. Philip Joel's comments in the first paragraph indicate that he believes. Are the hedging words?
Philip Joel's name and believes.
This we have already taken this paragraph for named strategy. Comments in the first paragraph. If there are beginners, first paragraph is important. It tells you that you have to number the paragraphs immediately. As soon as you start to answer the question before that, you have to number the paragraphs. Indicate that he believes. Believes means his opinion, right?
Yes, Father.
He believes. Option 1, no one knows how to prevent plague.
No one
is
in
absolute.
Absolute.
So what happens?
Not eliminated. Because the
No, Father.
opinion.
All option there is absolute.
Oh, then we can eliminate all.
No, D
Okay,
is the answer.
Father,
let's see. B, everyone has plague
Everyone.
on their teeth.
Everyone.
What is it?
Is absolute.
Absolute.
everyone
So,
is
Only is
eliminate.
absolute.
This is the best example for opinion. Or see option C, only fluoride can remove plague.
Only.
So
Absolute.
D is the answer.
eliminate. Plague is impossible to remove.
Impossible.
possible.
Impossible is absolute, but we don't eliminate it. Why? Because this is an opinion question. He believes. Madhusri believes he is the best guy. But Jaya knows he is a nasty guy. You understand the difference?
Yes, Father. Their opinion.
Yeah, opinion. That is an exception. Not always, okay? Sometimes. Now, what is the criteria here? Since all these 3 are eliminated, the 4th one must be the answer. Okay. that is given at the end, so we can conclude that. But there is the absolute. So how to find out the answer easily? Yeah, fast.
Let us name base. We can go by name further. First.
Immediately go to the such a name in the paragraph.
Where is the
Answer
name?
is there.
Where is the name now? Philip
Yeah,
Hijo.
Third line.
Future.
seventh, ninth line.
No, name is here. Philip Hijo is here.
Yes, Father.
Then says
He is there somewhere? No. Pronoun also allowed to see and look into. Others.
Oh.
Others not
Others.
required.
no.
Others not required.
Those not. Those in the first camp not required.
Hijol says.
That is
Yeah,
Hijol
he
says.
says.
Hijol says means he
The
is
place is
synonymous of
inaccessible.
Like is
synonymous of he
inaccessible
believes.
time.
He says
He
in the
says.
second last
He
line.
says. He says.
According to his
According to Fujo.
According to the Hijol.
According to Hijo, there is a spelling mistake. Okay, that must be a writing.
Then he
Right.
says the same line for the last.
He says.
He says.
He
He
says.
says. He says. In general,
Expert belief.
there is some evidence it may be inspiration. In general, experts believe.
Experts. That is others.
Experts believe we are not bothered again. So where is the answer?
next to the others, the plug is incredible and you can't get to it.
Inaccessible and you can't get to
The
it.
plague is inaccessible
Inaccessible
and you can't get to
to it.
Sorry. Yeah.
Okay. What does it mean? Any similarity to any option?
Yes, Father.
Option
D,
B,
Father.
impossible.
Like it's impossible to remove.
Inaccessible means impossible, right? You
Yes.
can't access it means how can you remove?
Mm.
You can't access, so you cannot remove. Okay, there is on the ladder of your house, there is something, but you cannot access it at all. It's so high. Can you remove it?
No, Father.
You can't remove. So you can all this PhD, all these. So if you remember, I told you
Subject complement.
all these are subject complements. You can simply ignore. You can find it long paragraph. Okay. Brushing and closing alone aren't enough to keep cavities away. According to medicine, the fluoride is always absolute. That it's not simply keeping the teeth cleaner for years. Dental professionals have debated. Dental professionals, we are not bothered about their debate, right?
Yes, Father.
Those in the first camp, we are not bothered. Others, we are not bothered.
Others
Experts,
also.
we are not bothered. That's the name, importance of name. When other things are there, just ignore all those things. Like here, you can ignore what dental these people say. Others argue. All this can be just ignored. May not mean. This also can be ignored. That's how you save time. So the paragraphs become very small. Okay. Do you have some more stamina?
Yes,
Father.
Yes. Want to see part B, how it works?
Okay, Father.
Let's set. So,
Excuse me, sir.
Now you see, we'll try some from one text, that is transfusion reactions. Have you done it? Transfusion reactions. Take 2 minutes break. Smile, enjoy, send some messages, and have some snacks, juice. We'll just see and confirm this, couple of them. You'll be doing it, okay? I'll be just observing and listening. Let's see how nice it goes. Have some snacks. Yeah, 2 minutes. You can even mute your video if you want to eat something without showing. Okay.
Excuse
Yeah,
me,
please.
Father.
Yeah, please. Others can ask questions. No problem. 2 minutes. Okay. After that, we'll be continuing. Yes, if you have energy. Do you have energy or stop it?
So can I have work?
Hello?
I need to join. I have a work. Can
Yeah.
I take a leave?
Yeah, please. Those are work and discuss it. Yes.
Excuse me, Father.
Yeah, please.
Father, I have purchased the crown.
Okay.
Yeah.
What's your name?
My name is Prabharani Debarma.
Oh, Bharani. Okay. Let
Yeah.
me check where are you. Thank you, Bharani.
Yeah.
Yeah, send me a message also in the WhatsApp. Okay, we are keeping a record of people who are supporting us.
Okay.
Their requests and messages will be responded early. Because that shows you are supporting the mission. This is done by the tech team because we are working on a ebook. It is a good deal of expense, which will be giving free. We are working on it, so tech team needs some financial support. That's why they have kept on this. I don't know how to work it out. All tech team does that. We also said that helps reaching more audience, more deserving candidates. Come on, just others who are who can manage taking snacks or juice and sending some message simultaneously, multitasking. Do it, okay? At YouTube. Take something. Yeah, please.
Excuse me, Father.
Yeah.
Father, you said about, you have mentioned about special class, special group, I mean.
Yeah.
So, Father, how to join it?
Do you know how to change your profile name? Because other day
Father,
I don't admit you because your profile name says 1+ node. Usually the spammers come with the
yes.
instrument names. You don't know how to change it?
No, Father, actually, I don't have idea much. Yeah, it's
So
okay.
what happens is that, no. That's why we asked you to watch 1 to 40 small episodes are given. In that we have explained all these basics in video form. One video says all the essentials required for OET studies at EduSkills. That gives small all these information. Maybe in 1 minute it explains how to change your Zoom name.
Okay, Father.
Yeah, somebody who can do it, please tell her how to change it. Assist her. Please. Hello. Someone is there. All about for snacks.
It's okay, Father. I will try now. I'll do it.
Papa, you can also take some snacks. You did not have anything? Hello. Am I audible?
Hello, Father. Yes.
One.
Yes, Father.
Yes, Father.
When you are ready, type in the YouTube comment space, ready. This is about question also. And say Joe says, yes, that's also a about question. I don't want to confuse with many other previous questions. Individual basis, individual circumstances. Space, is why it is our signature. Press the like button, share the link to your friends. Yeah, thank you, Manjushibu. Manjushibu says you have to press the like button and share the link to your friends. Yes. Jabila says absolutely free platform. Rosina Joe is ready. Salafa is ready. Salafa, we will be thinking of model verbs. For only one session, here send me a suggestion. Today I had connected it, but if you want detailed sections, you can ask that.
Oh, excuse me, Father.
Yes.
Father, I have changed my. I have given the name.
Okay.
Prabha.
Prabha.
Yes, yes.
Yes. Because you don't know who all are attending it. There are the instrument names, sometimes they don't know.
Yes.
They don't know
Yes.
samples or boards or boards. Yeah. Josina Joy, ready 100%. Thank you for the super chat, Josina. Did all succeed finding how to get a super chat? You can use this time if you have not succeeded. Yes, please. Always make sure if you can afford at least 10 rupees super chat. It's not money, but I can get 100,000 rupees instead of asking 100 people 4,000 rupees. I can get it within 5,000 rupees. Now, 100 people get a purchasing super chat of 10 rupees each. It's not 1,000 rupees. It is a reach to the channel, reach to the deserving people. That helps us. And I'm waiting for 1 or 2 days. After that, we will cancel this general beginners batch if you are not really interested to attend sessions and do the tasks. We'll go only with those people, only in Zoom, not in live. Yes, I said ready. Yes. Senior Brown ready. All the things, yes. 100% Joseph. I got only 4 readies. Others, are you ready? Just type in the comment space if you are ready. All type in ready or ready. I love OET. Yes. Can I have the Zoom link, please? Yes. It is posted in the main platform. No, in the comment space. Yes, I am posting it again. Those who can interact, those who are interested to interact. Video, long here. Yes, I'm posting it repeatedly in the comment space. And see that it is. Yes. Yeah, somebody over here in requested me to ready for that. Yes. Writing session, please. Yeah, we will put writing session. Reading, listening, then writing. Ready for that. Yes. Ready, ready. How many readies are there? Only 3 readies. Chapter is 10. It has to be 30. Those who are free, just send some messages in the YouTube comment space. Fast. It need not be one message. You can send 10 messages. Some emojis, some likes, some thumbs ups, some smileys. And it go together. A chat it has to be. You probably smileys. If somebody is you're not working. Yes. Lower the volume of the second instrument. Somebody is using a second instrument. Please. Please. Are you listening to me at the Zoom classroom? Somebody is using a second instrument. I think, Prabha, do you have the second instrument? Hello. If you are using a second instrument, you have to lower the sound of one instrument. Otherwise, they will give echo. Yes, it is something now. Yes, chapter it is only 11. When it is 30, we will start. Send chats. Some are very confused. They don't even want to just send a emoji. It's just 11. See, please stop in sending messages. Other how to join the special class. I am tired of admitting people and removing people from special classes. So we will have to set full stop now. So means you'll have to come with your name in the profile. If you come with instrument name, you cannot admit people. Which will say the services. So let us reach 17. Has to read 30. If you stop, it will go down. Chat fast. 17 to 17. Fast, take the snacks, right? You have energy now. Dharmoga, good afternoon or good evening. Yes.
Good morning, Father.
Good morning, yes, morning for you. Right. Today off, right?
Yes, Father.
Yeah, when shall we begin our discussions?
Yes, Father.
On Monday?
Yes, Father.
Dharmoga, can you hear me? Please, second instrument.
Second instrument.
Hello, Shanmugha, can you hear me? Are you traveling? Hello. is driving. Shall we go? 31. Yeah, it reached 30. You start. Now you see this, what next one I am taking as a specimen. This is from transfusion reactions. That is the heading of the A part. And text C is witness resuscitation attempts. And a smoker's right to surgery is two texts in C. You can find it. Exactly, I want to show you how these strategies can be applied. First and second, we don't have this elimination strategy. Other things we'll check. Okay. What does the policy for manual handling equipment tell employers? Fast. Hedging words.
Policy.
Policy, type of document. Yes.
Manual handling equipment.
Annual handling equipment.
Okay. Then tell employers is important.
Employers. Tell employers.
Telling employers, yeah. Something is telling employers. So the important concept is manual handling equipment. Okay. Option A, all areas of the hospital should be fitted with overhead tracking. First.
All is an application.
All should be fitted.
So you have to say what should I do after that?
Absolutely. Eliminate.
Okay. B, option B, assistant devices should be used over physically handling the patient.
Yes.
Assistance devices.
Assistant device is manual handling equipment.
What are the keywords, heading words?
Assistant device.
You physically handling of
Physically handling.
physically handling of the
Physically handling the
patient.
patient.
Okay. Option C, patients have the final decision on how they should be assisted.
Patients.
Final decision.
Final decision.
Final decision.
Who can take it up? Read and explain, yes. One is anyhow removed. Now the option B and C remains. We have to find out the answer. Yeah. Read and explain. Speak loud. Read loud and speak loud. Yeah. Thank you.
Policy for manual handling equipment. The provision of ceiling hoist technology and air-assisted patient lifting equipment should be considered as the first-line handling aid by employers. As significant evidence exists that their use reduce operator and the patient injuries. Overhead tracking should be installed in all new or refurbished facilities. This should be cover beds as a minimum, but should extend and institutes and other areas of the facility where patients are likely to require assistance. Once an assessment has been made that equipment should be used for safe patient handling, then equipment should be available and used, even in situations where the patient and our family preference is for not to be used. Topic sentence, the
No
provision.
option.
Yeah, explain.
So C is
So-
also eliminate because in last line they said that even in situation where the patient and family preferences is not for it not be used. So C is also eliminate.
In the topic sentence it's telling the first line handling aid by employers should be used over physically handling.
Yeah. So that is first line means should be used, must be used. Right? Physically handling and assistant devices should be used over. That is the first line, handling aid by employers. Correct, no?
Yes,
So the topic
yes,
sentence gives the answer. Cool. All is there. So one absolute is there. So the business is very easy. You have to decide between B and C. This is from the same materials. Okay. Okay. Right. Installed in all new refurbished facilities. All areas of the hospital should be fitted with overhead tracking. Are they same? That says all areas. This says installed in all
The
new or
refurbished
refurbished.
It is
Means
new
some-
or refurbished facilities only,
refurbished.
not
so
all
means
hospitals,
this is,
all the
this
area
is,
of the hospital.
the text means some areas, but the option A says all areas.
All areas, yes.
So B is the answer. Next one. Okay. Yeah, this is from the same text, okay, same material. Fourth one, third one, fourth one, fifth one. Everywhere there is some absolute use. Yeah. The purpose of the notice is to explain to occupational therapists that
Purpose.
The
Purpose.
purpose of the notice explain to occupational
Explain.
therapist.
Therapist.
explain. Then option A, confirmation of equipment is subject to availability at the time of request.
Confirmation of equipment.
Equipment. Availability of the request. Time of request.
Yeah. Then B, mattresses are of standard size, so may not be suitable for all bed types.
This is absolute further, but it is not
No,
absolute.
Not absolute.
that's
Not
so
Suitable,
absolute.
maybe some suitable. This is maybe answer. Possible 90% of the chances of the answer.
Yeah, don't believe her. Okay. Let's see. Right. Option C, patient factors must be considered prior to lodging request form.
Patient factors.
Yeah. Now who can read and tell me which is the answer?
Equipment request form for pressure care mattress. It is the responsibility of the occupational therapist attending to the individual patient to submit an equipment request form based on the equipment eligibility criteria. A pressure mattress may be appropriate when someone is risk of a pressure injury as the evidence by documented sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. Environment and equipment consideration must be confirmed, such as the patient's weight is within the safe workload the equipment requested. The size of the mattress must also be compatible with the other bed equipment and accessories, and the patient has been informed regarding the contraindication of placing items on the top of the mattress. Only after this confirmation should ERF should be submitted. It is in the topic sentence, it is saying based on the equipment eligibility criteria. Then the patient factors we can eliminate further. C answer option, because it is the based on the eligibility criteria only. Patient factors must be considered.
Yeah, equipment eligibility, not the patient eligibility. Yeah. Which means equipment, this pressure mattresses will not be ready for all types of beds and patients, right? They are of standard size. So the controlling idea, the topic sentence, the controlling idea in the topic sentence itself says B is the answer. Availability is not mentioned at all. Right?
Yes, sir.
Yes, Father.
Yeah. If I understand that you have a silence here because maybe little higher language, you don't get it easily. But gradually you will understand. Based on equipment eligibility criteria means not patient eligibility criteria. Equipment of standard size. So you have to request if that equipment is okay for you. Right? See, you want to buy a dress, churidar. You will buy only if it fits you, right?
Yes,
or you want to buy for your father or mother, for mother, not children, for father. Okay? For mother, you want to buy one. If it fits, you will buy. So before you buy, you should confirm that it fits your mother, the size and all those things. Yeah, exactly that's it. This is from the same material again, fifth one. Okay, this fourth vegetable criteria. Okay, right. Yeah, that is 2, 3, and 4. 5, 3 were there. Okay, this is from another material. You want to do just this guideline extra says that the nurse in charge.
Guideline
Fast.
Guideline
Okay.
says nurse in charge.
Nurse in charge.
Yes. Okay. Option A.
Must supervise.
Must supervise the opening of the controlled drug cupboard. Must supervise.
Must supervise.
Then
Should.
Option B, should make sure that
Should
all
make.
wall cupboard keys are kept together.
All is absolute. We can eliminate further.
Option C, can delegate responsibility for the cupboard keys to another wall.
Can delegate.
Can delegate responsibility to another word.
Okay. Medicine.
Cupboard keys.
Cupboard keys.
This is the heading. Yeah. Now you have only two options. Must supervise, can delegate. Only two concepts. Whether you can must supervise or can delegate responsibility. Yeah. Somebody read and explain.
The keys for the.
I'm glad that you are able to explain. Okay. That's great. That's the advantage of being an active learner. Gradually, I can evade from the seat and you can carry on. Yes. Yeah, come on.
Medicine cupboard case. The case for the controlling drug cupboard are the responsibility of the nurse in charge. They may be passed to a registered nurse in order for them to carry out their duties and return to the nurse in charge. If the keys for the controlled drug cupboard goes missing, the locks must be changed and pharmacy informed and an incident form completed. The control drug cupboard keys should be kept separately from the main body of keys. Apart from in exceptional circumstance, the key should not leave the ward or department. If necessary, the nurse in charge should arrange for the keys to be held in a neighboring ward or department by the nurse in charge there. This C.
So C is the option in the last line, if necessary.
If necessary, exceptional.
Yeah.
Yeah.
Exception based question. Should be kept separately is opposite of should make sure that all ward cupboard keys are kept together. Kept separately, opposite of the option. Must supervise the opening of the control type, not mentioned, right? Not given.
Yes, Father. Not given.
Not,
Yes.
see, this is exception based because you see the
Then
structure
also,
you see.
Father,
Yeah.
the says is coming, that is opinion, but it is must. It is we can that also we can eliminate the A answer option. Must supervise.
Yeah, must supervise. This is says, so you cannot say use must require. For says is, yeah, opinion.
Suggest.
Yeah, suggestion. That's okay, even otherwise.
The topic sentence also it is saying.
Yeah, now you see the keys for the control drug cupboard key are the responsibility of the nurse in charge. Who is responsible? Number one, okay, that's a general statement. They may be passed to a registered nurse. Already it says it can be passed. Okay, it can be delegated. But then,
it will be.
Yeah, then duty number one, it can be passed to a registered nurse. Duty number two, if the cupboard key is missing, what will be done?
Lock must be changed.
Duty number pharmacy should be informed and incident
form completed.
The keys should be kept separately. Duty number 5. Apart from the exceptional the keys should not leave the ward department. Duty number 6. Okay, 6 duties are given. Actually, the topic sentence says it is the responsibility of the nurse in charge. Which one? The keys for the control drug cupboard are the responsibility of the nurse in charge. But there is an exception. If necessary, is the expression. The nurse in charge should arrange for the keys to be held in a neighboring ward or department by the nurse in charge there. This is called exception-based question. Always exception-based questions will have answer in the conclusion.
Yeah,
Conclusion.
conclusion. Yes.
That's the
There is
beauty of
two
the
if there is other.
Pardon?
There is two if if first if is saying if the cupboard key is missing or a lock must be changed, and then the second if is saying if necessary the nurse in charge should arrange for the keys to be held in a neighboring ward, which means the if necessary they can transfer the key to another ward.
Yeah, can delegate the responsibility for the cupboard keys to another one. Arrange for the keys to be held in a neighboring ward means delegate the responsibility for the cupboard keys to be held by another registered nurse in the neighboring ward or department. That is a paraphrasing. Correct?
Yes.
Yes, Father.
And this is what I said, the key word. No? See, this one carries the word keys to another word. Do you have keys in any other? Keys are kept together, but absolute is there. Now you see keys. They means keys, 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 keys. This is a key word. The key is given in the second option, but absolute is there.
Absolute is there, and further they mention keys should be kept separately.
Yeah, opposite of what is given in the text. In both the ways, that is wrong. So even if the keyword is there, since absolute is there, that is eliminated. Otherwise, you see only option 3 carries that keyword. Keyword is mentioned in here 1, 2, 3, 4, 5, 6, 7, 8 times in this such small paragraph. The repeated keyword says this is the one. If you want the exception-based question strategy, see what is the structure of this one? The job description. No? Except key is responsibility of the nurse in charge is the topic sentence. Responsibility 1 may be passed to a registered nurse. Responsibility 2, if the keys go missing, change the locks, inform the pharmacy and complete an incident form. Responsibility 3, keep the keys separately from the main body of keys. Responsibility 4, that is the exception. Keys should not leave the ward or department apart from in exceptional circumstances. That's why it's the exception case. This talk or time for Indians, right? For lunch. Let's try doing this. When seeking consent for a post-mortem examination, it is necessary to fast.
Consent.
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 Consent for postmortem examination.
Yeah.
It is necessary to.
Necessary to.
Give a valid reason for conducting it.
Valid reason.
Okay.
Valid reason.
Then allow all
All
relatives.
relatives.
Allow all
Is
relatives, all its absolute. We
Absolute.
can eliminate.
So what?
only is absolute.
Only raise the subject
Raise
after
subject
the
after
death
that
has
has
occurred.
occurred.
We can eliminate.
Also.
Father.
Only can
Everybody.
eliminate.
Delete.
Then I will have to eliminate the whole paragraph. Right?
Yes, Father.
Yes.
Because A is the answer.
Yeah, I eliminated the whole paragraph. I don't want to do anything. If you say, I obey. Okay. You don't want to take much time on time. So give valid reason if you want to see what is the answer. Most appropriate the person consenting will need an explanation of the reasons for the
Person will need
postmortem.
explanation of the reasons.
And not to all relatives. Yes, to the most appropriate person. Consent must be got from most appropriate person.
person.
Yeah.
See
There is
answer
no
on
need to
No
wait
need to
until
wait
the patient
until the
has
patient has
died.
died. Only raise the subject after that.
No
That's what
need
that
to
that
wait
law
until
says.
the
Yeah.
patient yes.
Thank you. That's it. Actually, I have the full one difficult to treat depression full thing prepared, but then today time up, you'll see next time, right? So how beautiful.
Thank you so much, Father.
Thank you so
all-
much, Father.
Thank you,
all-
Father.
You are most welcome. All your thank yous can be in the YouTube comment space so that at least that helps us to be, yeah. Yes. Our admin Nitya is not smiling. Sharmogaji, you were driving, I think, when I asked you something.
Father, sorry, Father,
Yes.
I was in a bus.
No problem, no problem. When shall we start the discussion? We are waiting for you. Shanboga discussion.
Yes, Father.
Monday onwards?
This week we can start, Father, but I
Yeah.
have 3 days again. But for the
No,
next
when-
month, I don't have much duties.
No
I'm
problem.
having
When you
like
have
two to do.
3 days, let me know. I am there. Nitya is there. Minnie Jackson is there. We all will adjust those days. Okay.
Okay, Father.
And our new
Okay,
new
Father.
admins are there. They will
Yes,
join
Father.
us.
I didn't meet them actually.
Yeah,
I didn't
yeah.
have.
Today, if you are free today evening, you can meet. There is an
I will
admin
try
meeting,
to
right?
join Father today. I have a
Nitya?
class, so I came
I
for a
see.
class.
Okay, okay.
But I will try to join during our admin meeting.
Yeah, possible. Today we have admin meeting, right?
Yes,
Nitya?
Father.
Yeah. Right.
Father, when we are having writing session?
Writing session after reading and listening, then writing, then speaking.
All right.
Father,
Yes.
Thank you,
we are
Father.
using same Zoom for discussion 5 o'clock and 8 o'clock. Is that right?
Hello.
Father,
Yes. Did somebody say something? Yeah.
I will share the task and I will ask the staff students to pick a slot. Then we can
Yeah.
start the discussion.
Yeah, sure,
Further.
sure. And I will ask during the admin meeting, we can ask the help of some admins, new admins who
Yes,
will
Father, because
support you.
this week I really need help.
Yeah. I am there. This week I am there. Only 13th I am not there. Otherwise, I'll be there almost always. Yeah, I'll join. This month I will be joining all the discussions.
Okay, Father.
And posting this one and all that. If there are
That one I can
no,
post and things further. I can arrange even whoever wants to pick a slots.
Yeah,
But the thing is, I cannot be there on the discussion
I
for
can be
4
there.
days.
Don't worry. I will
Yes,
be there.
Father.
Don't worry. And
Thank you, Father.
yeah, and those who are not active, we will remove them from that discussion group. Okay, not at all responding, not at all attending. You can remove them.
Okay, Father.
Yeah. These days you can just tell them if you are going to be active, let them start messaging. You're responding to your notice. Otherwise, tell them they will be removed.
The only few people are waiting for the task and they're like sharing the task if I'm posting anything. Others, they are not responding.
Yeah, maybe give some task from that episode 1 to 14. You can give some
Okay,
for them
Father.
to just watch and see the response. Okay? Episode
Yeah.
1 onwards, 2, 3, you can give one day. Small episodes.
Okay, Father.
Then you can let them give you a response in the comment space and in the group. So that we know how
Okay,
many are
Father.
active members. Yeah. Okay, then everyone, keep Vantika, don't worry. You can watch the
Thank you,
videos.
Father.
Everything is there. 21 steps about writing. Okay, in the YouTube channel, every day it is posted in the main platform. You can watch those videos if you are in a
I've
hurry
seen
to write.
everything, Father. Thank you so much.
Okay.
Thank you
God
so
bless
much,
you all.
Father.
Go for
Thank you,
lunch.
Father.
Nitya seems to be hungry. Yes.
Thank you,
Yeah,
Father.
bye-bye.
Today I want to join the admin meeting, Father. I am busy after.
Thank you very much, Father.
Okay.
Thank you, Father.
Okay.
Okay, Father.
Thank you, Father.
Father.